Welcome to this unit on impact assessment. By the end of this unit, you will be able to explain what an impact assessment is and how it is used in AI for health. What is an impact assessment? An impact assessment is used to predict the consequences of a current or proposed action, policy, law, regulation, technology, service. Impact assessments can provide technical information on risks and possible consequences, help improve decision-making, transparency and participation of the public in decision-making, which can help to introduce a framework for appropriate follow-up and measurement. Impact assessments are important for AI for health because they involve the introduction of new technologies and services. Technologies and their consequences can change over time. Impact assessments can also be used to determine whether a technology will respect or undermine ethical principles and human rights obligations. Impact assessments and human rights. According to the United Nations Special Rapporteur on Freedom of Expression, human rights impact assessments and public consultations should be carried out during the design and deployment of new AI systems, including the deployment of existing AI systems in new global markets. The UN Guiding Principles on Business and Human Rights establish corporate responsibility to respect human rights. This includes the requirement for companies to conduct due diligence to identify, avoid, mitigate, and remedy the impact on human rights for which they are responsible or indirectly involved. Although the UN Guiding Principles do not require businesses to conduct human rights impact assessments, such an assessment can help companies to meet their obligations. Human rights impact assessments have also been recognized in national laws as an obligation of companies that design AI. For example, the French government enacted a law on duty of vigilance. This requires parent companies to identify and prevent adverse impacts on human rights and the environment resulting from their activities, the activities of companies that they control, the activities of the subcontractors and suppliers with which they have commercial relations. Other types of impact assessments. Other types of impact assessments that have been either proposed or implemented include an ethical impact assessment, an algorithmic impact assessment. An ethical impact assessment is used to identify the impact of AI on human rights, for example on vulnerable groups, labor rights, environmental rights, and ethical and social implications. An algorithmic impact assessment was proposed by the AI Now Institute for Public Agencies as a practical framework to assess automated decision systems and to ensure public accountability. Both ethical and algorithmic impact assessments would enable affected communities to obtain information on how automated decision systems function and to determine whether they are acceptable. Ethical and algorithmic impact assessments would also enable governments to assess how AI systems are used, whether they have disparate impacts on the basis of gender, race, or another dimension, how to hold the systems accountable. This could be useful for governments as they turn to algorithmic decision-making for large and small-scale healthcare decisions. Laws for impact assessment. Several laws have been proposed or implemented that require impact assessments, including for the use of AI for health. For example, in 2019, 2 US senators proposed the Algorithmic Accountability Act, which would require companies to study and adjust flawed algorithms that result in inaccurate, unfair, biased, or discriminatory decisions that would affect people in the USA. It would also require companies with enforcement by the US Federal Trade Commission to reasonably address the results of such assessments, including algorithmic decisions that affect health. A separate proposal under the proposed legislation would require companies to conduct data protection impact assessments for high-risk information systems, such as those that store or use personal information, including health information. This would mirror the impact assessment required by law under the EU GDPR, which requires companies to conduct data impact assessments where data processing operations are likely to result in a high risk to the rights and freedoms of natural persons and their impact on the protection of personal data. WHO recommendations. WHO recommendations for impact assessment for AI for health are: 1. Governments should enact laws and policies that require companies to conduct impact assessments of AI technologies. 2. Companies or developers should conduct impact assessments as per the UN Guiding Principles on Business and Human Rights. 3. An independent third party should audit impact assessments before and after the introduction of an AI technology. You have now completed Unit 3 of Module 5, Building an Ethical Approach to the Use of AI for Health. Now try the end of module quiz to review what you have learned.